Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is the use of Ozempic and other GLP-1 drugs. Dr. Raja, what is Ozempic and other GLP-1 drugs?
Ozempic is a drug that is used to actually treat diabetes. And in general, GLP-1 drugs are drugs that are meant to mimic a gut hormone called GLP-1. So what these drugs tend to do is they tend to increase the production of insulin, which then helps an individual break down blood sugar and keep their sugar levels down, and that's why it helps patients who are diabetic. But what it also does, it also controls hunger, which is a reason why they're used to control hunger, manage some diabetes as well.
Why are these drugs that are originally made to help with diabetes being used for weight loss?
So what happens with these GLP-1 drugs is one of the effects, or the way they have an effect, is they tend to have an anti-inflammatory effect. And that in general can be a good thing. So when you have an anti-inflammatory property that aids in many other scenarios in the human system, so what they're beginning to see is not having inflammation improves aging. Not having inflammation around is beneficial for your heart. It's beneficial for your joints. So suddenly now people are beginning to look at these drugs and say, oh, maybe there could be uses in many other indications or disease conditions, simply purely because these drugs have that anti-inflammatory property.
Now, what can happen if someone uses them and that isn't diabetic? Is there risks to that?
Right. The biggest risk being if they're using it and they're not diabetic and they're not actually trying to use it to control their weight, the biggest downside is malnutrition that they're going to see because they're rapidly going to lose weight and they're not going to have that sensation of hunger, and therefore they're not going to want to eat, and it ends up becoming a malnutrition scenario, and that is also not a good thing.
What are the common side effects associated with long-term use of these drugs?
In some patients, they tend to have discomfort in the GI region, so basically just upset stomach, either constipation or diarrhea, like it depends on the patient, but basically gut-related issues tends to be the most common side effect or symptom that they're feeling when they're taking these medications.
Any last thoughts?
While these are all new therapeutics, they are available as options for people. So at least being aware of it, speaking to the physician, diagnosing these things early so that they can get on a treatment option would be the best way to go about it.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.